Well, hello to you, our listeners, the manipulated and the manipulators. Welcome to the OMM Research Podcast. The OMM Research Podcast is produced by DO-Touch.NET, a practice based research network that focuses on osteopathic manipulative medicine research. DO-Touch.NET is based out of the A.T. Still Research Institute located at A.T. Still University in Kirksville, Missouri. Please note that the views and opinions of the panelists in this podcast are personal to each panelist and do not reflect the views or opinions of A.T. Still University. My name, as always, is Corey Lubring, and I am the practice-based research coordinator of DO-Touch.NET and the host of the OMM Research Podcast. Before we get started, as always, we want to remind you, our listeners, that this podcast recording has video recorded with it and can be viewed on the DO-Touch.NET YouTube channel. Starting off, we want to introduce our panelists for this episode, starting with Dr. Stacey.
Hi, my name is Stephen Stacey. I'm the Director of Osteopathic Education for the La Crosse Mayo Family Medicine Residency Program and Associate Professor of Family Medicine at Mayo Clinic and an osteopathic researcher.
And thank you again for being with us this month. And we have a new panelist in this episode, and we are happy to introduce Dr. Moreno.
Hello, I'm Julien Moreno. I'm a French osteopath and I'm also teaching in a French school. I'm like a educational coordinator, so I just run the things and make sure that everything is okay in the school.
And we are excited to have you with us, Dr. Moreno, this month. Thank you for joining us.
Thank you.
So we'll be starting off this episode with an article brought to us by Dr. Stephen Stacey, which is looking at therapeutic mechanisms of fascia manipulation.
That's right, that's the title, Therapeutic Mechanisms of Fascial Manipulation, a Scoping Review by Drs. Yuichi Isagi et al. And we're keeping with the tradition of me butchering author names. These authors are from Japan. The journal is the Journal of Bodywork and Movement Therapies. This was published in May 2025. The objective from the abstract was to summarize current evidence on the physiological, structural, and neuromuscular mechanisms underlying fascia manipulation as a therapeutic investigation. And the findings, again from the abstract, fascia manipulation exerts its therapeutic effects through a combination of anti-inflammatory cytokine modulation, mechanoreceptor stimulation, and improvement in fascial gliding and proprioceptive feedback.
Sounds interesting. So, what about this article? What made you want to bring it to us for this episode?
This is a really cool article looking at the underlying mechanistic rationale of a lot of things that we do. And they even had a pretty good reason for looking at the rationale of the mechanism. So they have seen that studies have shown effectiveness in fascial manipulation, but the underlying mechanisms haven't really been organized really well into a single place. And so the purpose of this as a scoping review was to provide a focal point for that organization. We've done a few different kinds of systematic reviews in this podcast. We've done um, systematic narrative reviews, we've done meta analyses. I think we've even done an umbrella review, if I remember right. A scoping review is another kind of systematic review. Its goal is to map themes and concepts, clarify terminology, and identify gaps in the evidence. And those three things, mapping themes and concepts, clarifying terminology, identifying gaps in the evidence, we're going to look at that and see how well this article did as a scoping review and what we can learn from it. Keep in mind that a scoping review really isn't structured or designed to prove efficacy or establish causality or quantitatively determine some type of effect size. It's really there to um, help guide future research and scholarly thought around a topic.
Interesting.
Yeah, and fascia is like a big trend. I don't know here in the US, but I know that in Europe it's like The big thing right now, everybody's talking about fascia and how it might work, might not work. So that could be really interesting to see what's in that scoping review. I didn't read it yet, so I, I'm excited.
Yeah, and I've seen fascia really it's having a moment recently, isn't it?
Yeah.
It's especially in the manual therapy world, a lot of the research coming out is showing the mechanistic rationale and the effectiveness of fascial manipulation. Um, and so in this article, what they were looking for in their review was studies that had human or animal subjects who received fascial manipulation and that the paper focused on the underlying mechanisms of
Hmm.
that manipulation. So maybe they did pre-post biopsies or some type of imaging, really whatever tried to help organize or helped establish what is the underlying mechanism. They looked at all the usual databases, including gray literature and unpublished studies. Um, they had initial extraction via ChatGPT, and then the investigator reviewed all the extracted information to ensure accuracy, which was an interesting design choice. It's not wrong per se, but they didn't really give a lot of information on what was investigator driven versus AI
AI.
driven in terms of
Hmm.
some of the outputs. And AI driven outputs aren't wrong any more than human driven outputs are right, but I would have appreciated a little bit more clarity in just understanding which is which they didn't really report on much.
Yeah, that's
That's always.
yeah, I was gonna say like that's the thing that I've even experienced in some of my coursework. Going into my doctorate and everything is the use of AI and research and everything, and at what level, especially with how new AI is, do we need to report exactly like what's the input, exactly what's the output, just to
Mhm.
make sure that we are completely transparent with the use of AI being involved in studies. Didn't mean to hop in, but it's something that I
No,
have experience with.
that's absolutely right. It isn't really standard or established how much detail is the right amount. All I can say here is it seems like the amount of detail they gave was not quite enough.
Mm.
And so you could go clear on the other side and give way too much detail, and then it's just kind of boring and irrelevant. But, somewhere in the middle.
Mhm.
That's always a problem when you write a paper because you don't have so much space and what what do you want to report, what do you don't want to report, what do you put in supplementary materials and everything, and especially with AI and with AI, sorry, it's it's like a subject because you don't really know. There's like a gray area in that AI thing, so there's not
Mhm.
like standardized I would say protocol, but it's sometimes you don't know, as you said, what's the human part, what's the AI part. So sometimes you don't know.
Yeah, and honestly, it can be so back and forth that drawing a line clearly between one and the other might be irrelevant. Um,
So
but
what
either way,
findings? Yeah, what findings did they come out of the scoping review?
yeah, it led to a really good mapping of themes and concepts. And table two is especially interesting. It shows the research findings from the different articles and summarizes them. I won't read the whole thing, but just highlight some main findings. They found, for example, that fascial manipulation reduced fascial densification, which seemed to be related to decreased unbound glycosaminoglycan water. So if
Mhm.
you look at what's going on molecularly with the fascia, you have these long chain glycosaminoglycans that are supposed to slide past one another, and they do that better when they are bound to water. And when the water leaves that binding, then the tissue adheres, the tissue becomes more dense, and they found that fascial manipulation seems to reverse that. Um, sort of unrelated to that, they found that it didn't activate coagulation pathways or increase thrombosis risk, um, which is a contraindication or a caution you'll see sometimes. And they looked at a lot of different molecular pathways, like anti-inflammatory effects through cytokine modulation, analgesic effects through adenosine receptors, and seeing opioid-independent analgesia pathways in mice, for example. They showed that it seemed to have a transient inflammatory response. And this was an interesting thing that they highlighted there, which, reading between the lines, they didn't really emphasize this a lot, but they seem to be drawing a distinction between acute inflammation versus chronic inflammation. So in chronic inflammation, it's more persistent, it's more fibrotic, it's macrophage and lymphocyte predominant, and it's associated with ongoing cytokine signaling, extracellular matrix remodeling, fibrosis. And that can be a part of the problem in a lot of chronic pain patients, versus it seemed that fascial manipulation probably induced some amount of acute inflammation, which they saw through increased temperature, different molecular pathways. And the thought there is that acute inflammation may lead to a short-lived, regulated, neutrophil dominant pro-resolution inflammatory response that is associated more with tissue repair and remodeling and less with the extracellular matrix densification. So I thought that was pretty cool.
Yeah, it's a little bit same thing happen when you do like HVLA or things like that. We know that there's like a little bit of inflammation after, but that's part of the process. So I would say it's a good thing if there's a little bit of inflammation after. It does not mean that there will be a lot of pain, a lot more pain, but it's something that something's going on there. And so
Yeah.
the what we did on with the patient is that we changed something in body's patient. So that's always something really interesting to see. And
And you could, oh, go ahead.
yeah, do you know if they talk about what kind of facial manipulation or facial technique or whatever, or is that really like general? Do they define the
They
facial thing
That
or?
wasn't really the main purpose of the study, and they
Mhm.
didn't really report on the specific fascial techniques used. They did exclude other soft tissue techniques that weren't reported as primarily fascia based. So things uh, like massage, for example, would be excluded if they didn't target fascia, especially. Um, they grouped all of these different pathways, and this is really what I think is helpful for a scoping review, is to give a way of thinking about the problem.
Mhm.
And so they grouped it into mechanical pathways, neurophysiological pathways, and biochemical pathways that led to improvement. So for mechanical, they said physical disruption of fascial adhesions or densifications restore tissue gliding and reduce mechanical irritation of nociceptive fibers. For a neuropsychological, they said stimulation of mechanoreceptors such as Ruffini endings and Pacinian corpuscles can modulate central pain processing and enhance proprioceptive feedback. For the biochemical mechanisms, they said modulation of inflammatory cytokines and receptors can lead to enhanced tissue regeneration by stimulating fibroblast activity and extracellular matrix remodeling. And so these are some really cool ways of organizing it. Where so that's in the plus. Any other comments on the plus side before I go to what I might have liked to see in this study?
Well, that's really interesting because there's like a lot of, how to say that, um, imaginary thing around fascia. It's like a lot of people think about it like it's a magic technique or something. So I think that's good just to have some insight on what's going on when we do facial technique and what could be the mechanism, especially just to have something plausible because not everything is like a mechanical thing we do. There's like a lot of, as you said, neurophysiological thing going on, and especially if we talk about a little bit about pain, it's also a lot about that. It's a really complex thing, and even though we study some technique, it's just part of the everything we're doing in the clinic. So,
Mhm.
what are your takeaway on that?
From the perspective of listing out some of the evidence, I thought they did really pretty well.
Hmm.
Um, you could have seen maybe a little bit more synthesis. So for the evidence review part of it, I'll give maybe an A minus. So still a pretty high grade. As a scoping review, I have to give this article more of like a B or a B minus because they don't really help with some of the other aspects of a scoping review, like clarifying terminology in the field. And the biggest ball they dropped, I think, was identifying gaps in the evidence. To
Mm-hmm.
me, that would have been the really, really helpful thing that this piece needs. You know, if they'd call themselves a systematic narrative review, I could have lived with that, but they called it a scoping review. And for me, that involves a little bit more flexibility in what you report and also really needing to identify like what is next for
Mm-hmm.
research. And you
Mhm.
can't end with just a bland like more research and bigger studies are needed, which is kind
Mm-hmm.
of what they said. You
Mm-hmm.
know, and you can say that about any topic in the world. But if they had gone the extra mile and said specifically, you know, here's what's going to be cutting edge fascial research for people who are focused on the mechanical properties.
Mm-hmm.
Here would be cutting edge fascia research for people focused on the neuropsychological properties. Here would be cutting edge research for people focused on biochemical properties. They could have taken that um, framework that they used and really helped drive it towards moving the field as a whole forward. And I was really disappointed to not see more effort put into that aspect.
Mm-hmm.
So, what would be the key message you would like our listeners to take away related to this article, Dr. Stacey?
If you're doing fascial manipulation or research in fascial manipulation, there's a lot of bench research that has been done on your behalf. Get to know it and design further research with that in mind.
And Dr. Moreno, if you had all of the funding that you needed and all the facilities needed to do whatever research you wanted, what would you see as next steps for something related to this study? Where would you take this information to the next steps?
Well, I think the first step would be something around what's happening directly on the chemistry thing in the tissue. What's going on the fibroblast, on all those chemicals inside the fascia, just to know exactly how and when it changes, and then just link it to the clinical aspect. So if we have a patient with such symptoms, how does the manipulation could affect those symptoms? Is that a real effect? It's so hard just to isolate the a specific effect, especially on manipulative therapy, osteopathic manipulative therapy, but manual therapy in general. So I would go this way first.
Awesome. Well, thank you very much for such an awesome article this month, Dr. Stacy. Before we move on to our next article, we do want to just remind our listeners that if you want to see our beautifully bearded faces, you can hop over to the DO-Touch.NET YouTube channel and watch the video that is associated with this podcast. If you want to check out stuff that's happening within the research network, you can go to our website, which is do-touch.net. That's do-touch.net to check out stuff that's happening within the network there. So our next article is brought to us by Dr. Moreno, and it is looking at the treatment of, or its use of OMT on the treatment of pain and disability in chronic low back pain.
Yeah, so the title article is The Effect of Osteopathic Manipulative Treatment on Pain and Disability in Patients with Chronic Low Back Pain, a single-blinded randomized controlled trial by Popovich and al. It's from the Journal of Osteopathic Medicine, and it's a 2024 article. So I really like outcomes article, and this one has just like a twist inside, and that's why I choose this one. It's an interesting article on, yeah, how they manage the the data management and where they're from, because there's like an origin story on where they're from in this study. So they try to compare immediate OMT within 3 or 4 sessions over 4 6 weeks, and they use like mandatory HVLA plus optional MET, soft tissue myofascial, and articulatory technique, and they compared it to a waiting period control. So it's a crossover, and I think that's a really interesting one, especially because the data are like a byproduct of another study, because that wasn't the main goal of the study. So it's a really interesting thing. So if we go to the objective, so the objective of this study was to evaluate efficacy of an OMT intervention for reducing pain and disability in patients with chronic low back pain. And the conclusion of the study is that OMT intervention is safe and effective in reducing pain along with improving sleep and anxiety profiles in patients with chronic LBP. So I think that's something really interesting because one of the main criteria was pain, but the interesting thing is with this study is that the main improvement is on pain and anxiety, and there's like a lot of good things inside, especially in the methodology. And the only thing I have is that the the data are, as I said, a byproduct of another study because the initial study was to validate a new seated balance test to quantify postural control, and they just took the data they took from this study to just write the article. So that's interesting. But the thing is that from a like methodological point of view, there's um, I would say some little tweaks inside that I just want to point out. Just for example, the crossover design was interesting for the seated balance test because it was designed for this test, but it was really not designed for the clinical inference on the I would say the data and all the outcomes. So
Yeah, I agree. I was
that's
looking at that
interesting.
thinking it was a bit of an interesting design
Yeah.
choice, and we covered this a little bit on last month's version. That was another article by the same group, but more on neck pain than low back pain.
Hmm.
Um, one thing that I think about as we're looking in these studies is what is the underlying question that they're trying to answer? Because a really, really interesting question is going to have relevance whatever answer you get, whether it's a positive study or a negative study. What would you say is the underlying fundamental question, like the unknown that they're trying to uncover with this study?
Well, with this study, there's like the unknown question is that is OMM helps with improving patients' pain with chronic low back pain in patients with chronic low back pain. But the
Is that
fact
an
is,
unknown though? Like I
no,
feel
no,
like
it's not.
that
It's not
study's
really
been done a
unknown.
lot.
It's
We
not,
kind
it's
of
not really
know,
unknown. But
you know?
well, yeah, I know. Well, if I go for the unknown, that's that's hard to say with this one because the first the data that come from another study for the seated balance test. So I guess that once they were designing the first study, the question was around this seated balance test just to help to assess and maybe guide the treatment with these tests. But for this one, I think it's more around the other outcomes, the secondary outcomes. So that's why I think they conclude that
Yeah.
the sleep and the anxiety was improving after this treatment. So the
And I think this maybe makes sense as exploratory research from that
yeah.
regard, is to say, let's look a little bit deeper into this.
Hmm.
If I think about how a lot of OMM research is performed, it's physician directed, very symptom focused, which isn't bad. It's just looking at things at a different level, and we've really looked at things on that level long enough. It it's sort of like if you were doing treatment for depression and saying people who see psychologists for their depression do better than people who just sit in a room and talk with an untrained professional for an hour.
Hmm.
Okay, so that validates, I guess, psychology as a profession, but it doesn't really help us answer the question of, is psychodynamic psychotherapy better or worse than cognitive behavioral therapy or behavioral activation? And that's kind of what I feel like we're missing in this study, is
Hmm.
that next level of like, what do we really learn about OMM from this study?
Yeah, at the end, I was like, okay, the anxiety, sleep were improved, but I was like on my end, and I wanted just a little bit more, and especially on those study where the secondary outcomes are like I would say, I won't say positive, but it's they're improving the secondary outcomes and not the first one. Sometimes it gives you a very good insight of what's going on, because maybe the secondary outcomes are the things that are important for the patient, just as from a pure clinical point of view. If I'm in the clinic, I see patient, and a lot of patients come primary for pain, but pain sometimes is not the first thing they want to treat. It's like the consequence, and
Yeah.
sometimes it's just that, of course, they have anxiety, they have a lot of stress, maybe sleep disturbance, and everything, and maybe just improving those aspects maybe won't improve the pain aspect, but they will manage it pretty well. And that's what it is interesting with this study, because we pay sometimes a lot of attention to pain, and pain is just sometimes a consequence. And it's like when you pay attention to something that's really important for you or for the patient, sometimes you loses the other things.
Yeah.
And that's
You
what
know, and
interests me with this study.
the opposite could be true too, where you're saying that these other factors are contributing to the pain, but then the pain
Mhm.
can also contribute to the other factors,
Sure.
which really gets back to the osteopathic
Hmm.
philosophy that form follows function and the other way around, right? So form and function are reciprocally interrelated.
Hmm.
They affect one another. And the manipulation that we do is designed to help with the function, with the somatic dysfunction, but we
Hmm.
can't really discount the therapeutic alliance that's formed purely through the act of treatment. And if that is found to be the underlying mechanism behind some of the treatment that we do, we can continue to hold on to that with our treatments as we continue to also look for, is there some treatment that we could perform that has more biologic effect than another one? And so one thing that this adds somewhat interestingly is forcing HVLA into it. It doesn't go quite as far as isolating the effect of HVLA, but it is a bit of a unique design choice.
Hmm. Hmm. Yeah, it gives a really great insight on how from a pragmatic way, when you're using HVLA, how it can help the patient and how it can improve things in the clinic. And what you were saying is interesting, because in the discussion there's like narrative opportunism at some point, when sometimes when they say pain improve, it's like OMT, but when there's not improvement, it's like the dose response or anything. So there's like a different levels of, I would say, explanation in the discussion. So it's it's really interesting to see that there's some effect, but we can see that it's really hard to say, to quantify this effect, and especially with the waiting list design, because it's just a waiting list, so it's not a
Yeah.
sham. It's not. So I would love to see some sort of study with another design and with a sham, just to see if there's any difference there.
Yeah, I think that more research that we do on the kinds of controls that we use, whether waitlist controls, sham control, different kind of sham, is a real um, opportunity for future OMM research. Is to say, what is the effect of our sham treatments, uh, and what do we learn about the treatment experience based off of those
Mhm.
effects? Because different kinds of shams are going to emphasize different aspects of it.
Yeah.
Hmm.
And with those kind of study, when I see sleep and anxiety improvement, what I like to see is like a nice qualitative research, just to get the patient's experience, just to have like
Mm,
a, a deeper point of view, not only statistical data. Statistical data are really interesting, but sometimes when you get to like human being and everything, just getting nice qualitative study helps you just to transfer things in the clinic, maybe sometimes more.
I second that entirely. I think there's
Yeah,
too much of a view out there that qualitative research isn't real science, but
it is.
it's oh, it is, and you learn so much from it. And through that qualitative research, you figure out what is the right thing to pay attention to with your
Mhm.
quantitative research. Um, that research needs all of it, and I think giving more priority to the qualitative research is really important.
Yeah, and that's why this study is really interesting, because it gives a lot of insight on what could be really interesting to focus on next study, especially I would say general psychosocial factors. And I would love to see a really nice and big qualitative study just to see, okay, so if there's improvement on those factors, so what's the patient experience? Why? I just want to understand what's happening there.
So anybody who wants to get that qualitative study started sounds like they need to reach out to you.
Oh yeah, I really love qualitative study. I discovered it when I did my master's degree, and I just fell into it. And it's like doing the clinic. You have like your interview framework, and you just try to to chat with people and getting some data, and after that you analyze that with your team, and you
Yeah.
discover a lot of amazing things, and you connect the dot, and it's like a map, a new map that you can see. And I love that,
Maybe we
especially
should,
combining.
yeah, let's have a qualitative study on our next podcast.
Yeah.
Oh yes, sure. I remember I went to first time in Kirksville. It was three years ago, and I was with Corey also. I remember. I don't know. It wasn't Corey, but I recorded. It was not like a podcast, but it was like a small presentation, and
Mhm.
I presented qualitative research on mental imagery in osteopathy, how osteopath uses mental imagery with their palpation skills, and just to represent them what they are palpating. And it was a really interesting one. Not a really, I would say, good one from a methodological point of view, but just the topic was interesting from an osteopathic point of view.
So, Dr. Moreno, what's the key message you want our listeners to take home about this article?
Well, I think for the practitioners is just paying attention to other factors within the clinic, not only pain, not only function, but how the patient is experiencing his pain also. I think that's one of the key point of this study, is just pointing that, okay, there's pain, but there's something else that is also really interesting. And that's why we're doing in the clinic. So that gives a lot of strength to what we're doing in the clinic, and we're not just only working on the patient's body. There's like body, mind, and spirit. So it gives the strength to what we're doing in our osteopathic practice. And no matter where you are in the US, in Europe, in Japan, or whatever, it's the same thing everywhere. So we just need to focus more on those factors, just to try to help people to get better.
Well said. Well, thank you both. Thank you for bringing that article to us this month, and thank you both for being on this episode of the OMM Research Podcast. Again, if you all want to find out more about what's happening at DO-Touch.NET, you can always follow us on social media or go to our website. That's DO-Touch.NET to find out things that are happening within the network. And I still want to give time for Dr. Stacey to talk about the upcoming conference that's happening at the Mayo Clinic.
That's right. Anybody who wants to come join with the osteopathic manipulation presentations and explore some new research directions, come to the Mayo Osteopathic Research and Education Conference on September 18th and 19th in Rochester, Minnesota.
All right. And Dr. Moreno, thank you very much for joining us on this episode. Dr. Stacey, good to
Thank
see you
you.
again. Yeah. And we will see you all next time.